What if you could see a public health crisis coming, weeks before it even hits? Well, today we're diving into PulsePredict, a pretty incredible AI platform that was designed to do exactly that. And it was built for one of the most complex healthcare environments in the entire world. And this quote right here, it really gets to the heart of what PulsePredict is all about. The whole idea is to take that unpredictable, chaotic surge of patients that can just completely overwhelm a hospital and turn it into something manageable, something you can actually plan for. It's a huge shift from just reacting to crises to actually getting ahead of them. All right, so here's our game plan for today. First, we're going to look at the massive pressure on India's hospitals to really understand the problem. Then we'll see how this idea of predictive care is changing the game. We'll even meet the AI team that makes it all work, check out the amazing real-world results, and then wrap up by asking, what could this mean for the future of healthcare everywhere? Okay, let's start with why PulsePredict even exists. We're talking about a situation that's been called a true healthcare pressure cooker. Why? Because the challenges that hospitals there face are things that most systems around the world, well, they just never have to deal with, at least not all at once. Now, the key thing to understand here is how all of these challenges are connected. It's like a domino effect. You have a huge festival like Diwali, and it's not just about potential injuries. The firecrackers cause these massive spikes in air pollution. That, in turn, leads to a surge of people with breathing emergencies, which overwhelms the staff, breaks the supply chain for things like oxygen, and leads to terrible burnout. It's just this relentless, cascading cycle of crisis. And to put that number into perspective for you, an air quality index, or AQI, over 300 is considered hazardous for every single person. We're talking about levels that shoot past 400. This isn't just a hazy day. It's a full-blown public health emergency that completely floods emergency rooms and ICUs, and it happens year after year. And here's the bottom line, the very real human cost of all this. When a hospital is always in crisis mode, the staff is just pushed beyond their limits, essential supplies run out right when you need them the most, and patient care is going to suffer. It's just not a sustainable way for anyone to operate. So, the big question is, how do you break that cycle? This is where we see a huge shift in thinking. Instead of just trying to get better at managing chaos, the goal becomes stopping the chaos before it even starts. You're moving from being reactive to being proactive. This is really the million-dollar question that PulsePredict was built to answer. Just think about it. What if a hospital administrator knew, with a pretty high degree of certainty, that a massive wave of asthma patients was going to hit them in 3 weeks? How would that change everything? Well, they could order the right meds, schedule the right specialists, and maybe even send out warnings to vulnerable people. It's a total game changer. Now, the tech that powers this is something called agentic AI, and the most important word here is autonomy. See, unlike the AI we're used to that just crunches numbers and gives you a chart, these agents can make their own goal-oriented decisions. Think of it less like a spreadsheet and more like having a team of brilliant, autonomous specialists working for you around the clock.
And PulsePredict is the platform that puts it all together. It's like the conductor for this AI orchestra, pulling together the power of all these different agents to give hospital managers what is essentially a crystal ball for their operations.
So, let's actually meet the team, shall we? PulsePredict isn't just one single AI. It's a whole system of them, and it's probably best to think of them as a highly specialized digital crew, on duty 24/7, working behind the scenes.
Each of these 6 agents is an expert in its field. You've got the demand prediction agent looking at things like festival calendars to see patient surges coming up to a month away. The environmental health agent is watching air quality data like a hawk. And get this, the epidemic intelligence agent is even scanning social medias for chatter that might signal a disease outbreak before it's ever officially reported. Each one has a super specific, super critical job. But here's the magic. They don't work alone. They're constantly talking to each other. So when the environmental agent sees a pollution spike coming, it tells the supply chain agent, hey, we're going to need more inhalers. And it tells the workforce agent to schedule more respiratory therapists. It all gets funneled into one central dashboard that basically becomes the hospital's command center for seeing the future. Okay, so that all sounds amazing in theory, right? But the real question is, does it actually work on the ground? Let's take a look at the real-world impact when you translate these predictions into action.
The numbers are pretty staggering. A 40% drop in patient wait times. That's a direct result of knowing who's coming through the door so you can have the right staff ready. A 30% reduction in supply waste. That's because you're ordering exactly what you will need, not just guessing at what you might need. And a 15% cut in overtime costs. That's huge for fighting staff burnout. These are not small improvements.
And the benefits just ripple outwards from there. With a few weeks of warning, an entire city's hospitals can coordinate their response to a major event. Public health officials can use this data to make smarter plans. It really becomes about more than just one hospital. It's about building a smarter, stronger, more resilient healthcare system for an entire community.
And that brings us to the big finish. Because even though PulsePredict was created to solve India's very unique problems, the way it works could be a powerful blueprint for the future of healthcare all over the world.
And look, this isn't just some science fiction dream. There's a clear, practical roadmap for how to actually implement this. It's a step-by-step process to make sure the system is trained on local data and test it before it's rolled out everywhere. It's designed to make this kind of sophisticated AI feel achievable for any health system that needs it. So we'll end with this question to chew on. The challenges in India, pollution, festivals, sudden outbreaks, they might seem unique, but the core idea is universal. As the whole world faces more extreme weather from climate change and the constant threat of new diseases, this need to shift from reacting to predicting has never, ever been more urgent. Could a system like PulsePredict be the key to building the resilient healthcare we're all going to need tomorrow? It's definitely something to think about.